Hello and welcome. Today we're diving into a complex and fascinating condition that can affect various parts of the body, including the nervous system, Behçet's disease. This rare disorder often presents diagnostic challenges, so let's unravel its mysteries and understand how it impacts those who live with it. The exact cause of Behçet's disease remains elusive, shrouded in uncertainty. Scientists believe it's a multifactorial condition, meaning it arises from a complex interplay of genetic predisposition and environmental triggers. While no single gene has been identified as the sole culprit, certain genes, particularly those related to the HLA-B51 gene, are strongly associated with an increased risk. Environmental factors like viral or bacterial infections are also suspected of playing a role in triggering the disease in susceptible individuals. At the heart of Behçet's disease lies a process of systemic inflammation, affecting blood vessels throughout the body, a condition known as vasculitis. This inflammation leads to damage in the vessel walls, causing them to become leaky and prone to clotting. In the nervous system, this can manifest in several ways. Inflammation can directly damage brain tissue, causing lesions and neurological dysfunction. Alternatively, the inflammation can affect the blood vessels that supply the brain, leading to stroke or other vascular complications. The exact mechanisms that trigger this inflammatory cascade are still being investigated. Behçet's disease is considered a rare disorder, with prevalence varying significantly across different geographic regions and ethnic groups. It's most commonly seen in countries along the ancient Silk Road, including Turkey, Iran, and Japan. Prevalence rates in these regions can range from 100 to 300 cases per 100,000 people. In comparison, it's much rarer in North America and Europe. While Behçet's disease can affect individuals of any age, it typically manifests in the third or fourth decade of life, and both men and women can be affected, although disease presentation and severity may differ. Behçet's disease is a master of disguise, presenting a wide array of symptoms that can vary significantly from person to person. One of the hallmarks is recurrent oral ulcers, which are painful sores that appear inside the mouth. Genital ulcers are another common symptom, similar in appearance to oral ulcers. Eye involvement is also frequent, with symptoms such as redness, pain, blurred vision, and light sensitivity. When the nervous system is affected, symptoms can include headaches, seizures, weakness or numbness in the limbs, difficulty with coordination and balance, cognitive impairment, and even psychiatric symptoms. Skin lesions, such as like bumps and painful nodules, are also common. Diagnosing Behçet's disease can be a real challenge due to its varied and non-specific symptoms. There's no single definitive test. Instead, diagnosis relies on a combination of clinical findings, patient history, and exclusion of other conditions. The International Study Group criteria for Behçet's disease are often used, which require the presence of recurrent oral ulcers, along with at least 2 of the following recurrent genital ulcers: eye inflammation, skin lesions, or a positive pathergy test. A pathergy test involves pricking the skin with a sterile needle and observing for an exaggerated inflammatory response. MRI of the brain and spinal cord may be performed to assess for lesions or other abnormalities affecting the nervous system. Blood tests may be done to rule out other inflammatory or infectious conditions. While there aren't specific subtypes of Behçet's disease per se, clinicians often classify the disease based on the predominant organ involvement. For example, some patients may primarily experience mucocutaneous symptoms, with oral and genital ulcers being the most prominent features. Others may have significant eye involvement, while still others, like we've been discussing, suffer primarily from neurological complications, a condition often referred to as Behçet's disease. This classification helps guide treatment strategies tailored to the individual's specific needs. Currently, there's no cure for Behçet's disease, so treatment focuses on managing symptoms and preventing complications. Medications used to treat Behçet's disease include corticosteroids to reduce inflammation, immunosuppressants such as azathioprine, methotrexate, and cyclosporine to suppress the immune system, and biologic agents such as TNF inhibitors to target specific inflammatory pathways. Treatment for Behçet's disease may require more aggressive immunosuppression. Pain relievers can help manage discomfort from ulcers and other lesions. Eye involvement may require specialized eye drops or other medications to prevent vision loss. Physical therapy can help maintain strength and mobility in those with neurological symptoms. Unfortunately, there are no proven strategies to prevent Behçet's disease, given our limited understanding of its causes. Since genetic factors are believed to play a role, it's not something that can be directly prevented. However, early diagnosis and prompt treatment can help minimize the severity of symptoms and prevent long-term complications, including neurological damage. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, may also contribute to overall well-being and potentially reduce the frequency or severity of flares. The prognosis of Behçet's disease is highly variable, influenced by factors such as the severity of symptoms, the organs involved, and the effectiveness of treatment. Some individuals experience mild symptoms with infrequent flares, while others face more severe and persistent disease activity. Neurological involvement can significantly impact prognosis, potentially leading to disability or neurological deficits. However, with early diagnosis, appropriate treatment, and careful monitoring, many individuals with Behçet's disease can lead relatively normal and productive lives. Research into Behçet's disease is ongoing, with scientists exploring new treatment targets and biomarkers to improve diagnosis and management. Studies are investigating the role of specific immune cells and inflammatory molecules in the disease process, paving the way for more targeted and effective therapies. Clinical trials are also underway to evaluate the efficacy of novel medications and treatment strategies.